We looked at 629 multiple myeloma patients who underwent autologous stem cell transplant at Dana-Farber Cancer Institute between 2003 and 2011. So we also are interested in studying the prevalence of clonal hematopoiesis of indeterminate potential, which basically reflects a recently identified phenomena where as you age, you start acquiring somatic mutations in your hematopoietic stem cells. And it was found that if you have clonal hematopoiesis, you are at a high risk of cardiovascular disease and developing additional hematologic malignancies. So we looked at the prevalence of CHIP basically in myeloma. It was around 22%, which is relatively high compared to the general population. And we found that in patients who do have CHIP, they have a worse overall survival and a worse progression-free survival after autologous stem cell transplant. However, in those who are receiving immunomodulatory maintenance, those negative effects of CHIP are abrogated and your progression-free survival and overall survival are actually matching or actually similar to those who do not have CHIP.